Italy to talk about radiomics in vascular surgery.
Okay. Good morning, everyone, and thank you very much for the invitation. It's an honor to be here, and it's a pleasure to share with you this topic, which is radiomics in vascular surgery. Radiomics is a relatively new process that it's been used in medical imaging to extract information from the images that we are used to see with naked eyes. What is exactly radiomics? Radiomics is exactly the process of the extraction of quantitative data, which are called features in radiomic analysis, from a standard radiological imaging and find a way to use them for clinical decision making or to interpret what we are seeing. Radiomics analysis works through a workflow. It starts with the acquisition of imaging. Then there is a segmentation, which I'm sure you are familiar with, of the images, selecting the region that we want to analyze from the imaging modality we have chosen. Then we have to generate radiomic features, which are this quantitative information that we are going to find and to look for into the imaging we are looking at. Then we develop a database with the features. Then with statistical tools, we analyze the features that we have extracted, and through a process of machine learning, we get new information that we were not able to get before. And this ends up in a radiomic signature. This is how it's called in the radiomic world, let's say, which is a model. It's a computational model that can be used and reused again, and it can be run again on different data sets. Let's see in details a little bit what it is all about, because I'm sure it's a bit confusing. So, again, first of all, we want to extract quantitative features from images. Images that we are looking at, imagine at a CT scan, have, from our perspective, a limited potential to interpret what we see. Through radiomics, we can get more information that we are not able to see with the naked eye. So this can be used in clinical decision making, it can be used in differential diagnosis, and it can be used also in predict outcomes in our patients. Imaging modalities that can be applied or can be used with radiomics are pretty much all the standard images modality that we are used to. We can run a radiomic workflow through ultrasound, computed tomography, MRI, PET scan, or X-ray. So we just need to have a standard radiological modality that we are comfortable with, that we want to interrogate, to extract informations. Then, as I was saying, we have to go through the segmentation. Segmentation can be as a ROI or VOI, which is not the region of interest or the volume of interest. This, again, is relatively easy. I'm sure you're all used to that with standard software that we can use. However, for a radiomic analysis, there are dedicated softwares that are usually open source softwares, like 3D Slicer, for example, is one of them, that you can easily learn to use. And basically, with the paint function of the software, you delineate manually, usually, the region of interest or the volume of interest. At the moment, most of those analyses are done by radiographers or surgeons or clinicians that actually do the segmentation slice by slice with the paint function. However, there are softwares that have been developed to do semi-automatic or automatic segmentation of the images. This is a critical point of radiomics, as of course, what we are going to interrogate with radiomics is the area that we have chosen. So, of course, if the area is precise, we will have precise information about the question that we are asking to our imaging modality. If the segmentation is not precise, of course, this will create a bias when we are going to interpret our results. This is an example, a very easy example of a segmentation of a carotid plaque from a CT scan with 3D Slicer. And this is an example of a segmentation of an aortic neck in an infrarenal aortic aneurysm. So you see, this looks very familiar, and we use that for many other purposes. Then we were saying we have to, once we have done the segmentations, we have to run the data from the segmentation through another software which helps to extract the features, which are the quantitative information that we are interested into, from the images. So This quantitative information are called features in radiomic analysis. There are approximately 200 to 300 families of features that we can ask the software to look into in our data. And for each feature, we can then select different criteria or thresholds, ending up in having thousands of features that we can analyze with these softwares. So it is critical to ask the right question to the images, to know exactly what we are going to look at, and then there is a process through which we are going to reduce step by step the features that we are going to use. Every feature is said to need the increase of one size of the sample of the patients that we are studying. So an ideal study would be a study where we are running a radiomic workflow, asking just for one feature to be looked at. So features can be broadly classified in three different families. There are shape-based features, which are very familiar. It's just the shape of the volume of what we are looking at. There are first-order statistic features, which results, as you can see on the top right of the screen, in a simple histogram, which describes the distribution of the grayscale without any relationship with space of what we are looking at. And then there are texture-based features, which you can see on the bottom right of your slide. This is a more complex thing to imagine because we are not used to think in this way. Texture-based features look, for example, you see GLCM, GLDM, GLRM. Each one of them is a feature that you can ask the software to run through your images. And they can look, for example, at the relationship between couples of voxel or pixel, depending on what imaging you're using, and to compare them with the couple next to them. You can see how many gray voxel or pixel are present within the same matrix with the same grayscale. You can ask the machine, for example, to tell you for the central voxel or pixel that they are looking at, what are the relationship with all the voxels and pixels surrounding them. So this is just to say that it's a way of looking at imaging that we are not used at all. It's not the conventional way we look at a CT scan. So what you see here is what the machine would look and interrogate on a CT scan. Now, we all know, for example, when you look at dissections, true lumen, false lumen, we can see clearly the discrepancies between the two lumens, and we know that there is a flow effect and so forth. We can look at lumbar arteries for a type 2 endoleak, and we will see the contrast flowing maybe on a late phase, arterial or venous phase, and we will recognize that there is an endoleak. But through radiomics, what we're asking the machine is not to recognize an endoleak or to tell us whether there is contrast or not. We are going to look into patterns of grayscale that are invisible to the human eye. So this is going to change completely the way we are going to use and look at any sort of imaging that we are familiar with. Once we have extracted our features, then we have to select the features, because the machine, as I told you, can give us thousands of features. And this is a very important step, because this is an important bias of radiomic analysis. They can look at pretty much anything, and it's very difficult to interpret the significance, the meaning of it. This goes through exclusion, for example, of non-reproducible features, selection of the most relevant variables for the task that we want to ask to our software for a specific clinical question. And then when we identify a cluster of features which are similar one to the other, we can take one of them to be representative of all this cluster. So basically, from hundreds of features, we have to go down and reduce it to tens, and then ideally 1, 2, 3 features. And this will help us having a functional model of radiomics that can be used in our clinical practice. Did I? Okay.
Do you need one more minute?
I can go quickly through it. Yeah, I'm afraid.
Okay, we can give him.
Then you need to validate your radiomic model, and it has to be reproducible and replicable. This is an histogram of the papers that have been published about radiomics up to 2022. And at the bottom, you can see the papers published in cardiovascular disease, only 167, while there is a lot of publications about hepatobiliary and gastrointestinal surgery. In vascular surgery, some examples of how radiomics have been applied. They've designed models that, looking at the texture of aneurysms, they could predict the expansion of the aneurysms, and they could predict the endoleaks that would eventually cause the expansion of the aneurysm. They could look at these sections, and they could recognize these sections in CT scans without contrast with radiomic models, and they could recognize through radiomic models vulnerable or high-risk plaques in carotid surgery in several studies, as you can see here. So, just as I'm running out of time, the message I would like to give you and to take home is that radiomics are here to stay and are going to change radically the way we are going to look and we are going to use and we are going to interpret any kind of imaging modality that we have, giving us information that we are not able to see with our naked eyes. So it's a very promising and very fascinating field which is fast developing. Thank you very much for your attention.